a very warm welcome to you all. We saw a number of you in the waiting room, so we thought we'd open up the webinar a few minutes early to let people join. We will start at exactly 1:15. So we've got a couple of minutes, so welcome to all of you. It's nice to see the numbers counting, going up. And for those of you just joining, a very warm welcome. We plan to start at 2:15 sharp. We just thought we'd open up the room, as it were, the metaphorical room, and get you all in. And our aim is to stay on time, but allow hopefully adequate time for you to ask any questions that you might have of myself and Anna. So for those of you that joined a little bit early, I apologise, I keep repeating myself, but a very warm welcome to those of you that are joining. It's really lovely to have you all join Anna and I today to talk about menopause. We will start the webinar at 2:15, but we're just opened the room to allow people to get in and settled before we get started. And it's lovely to see the counter going up as we wait for 2:15 to come along. Our aim is to get through as much of the knowledge piece as possible to allow kind of as many open questions as any of you might have. Feel free to ask me anything that you want to ask from a personal perspective, and Anna is our nurse professional on our team. So between us, we will have a good go at answering any questions you might have. Okay, so I think we've hit 2:15, and a very, very warm welcome to everybody that's taken the time to join Anna and I today for a very brief webinar on menopause made clear, and how advanced testing can transform your journey. So we'll do a combination of Anna and I speaking today. Tegan, if you'd like to go on to the next slide for me, that'd be lovely. So just a bit of background. My name is Dominique. My background has been predominantly working in social care, where I led a home care organisation for a number of years. I've also worked in the care home sector. I'm very privileged because I do hold a number of non-executive roles as well alongside my day job, where I get to have an impact across things like mental health, and more social care businesses, but also working with people that are sectioned, which is really interesting. So I guess the theme there is I don't do anything I care about. And Anna, if I could hand over to you to introduce yourself, that would be lovely.
Thank you, Dom. So good afternoon, everybody. So delighted to see so many of you join this webinar about such an important subject. So I'm Anna, I'm the chief nurse here at Bluecrest, and I've been nursing for 30 years. I've got a real passion for making sure everything we do at Bluecrest is of the highest quality. But my passion and why I do what I do is to help bring insights to the customers that we serve. And a particular interest of mine is around women's health, and menopause is such a misunderstood subject, and yet there's one in three of us in the UK in perimenopause or menopause, and we just need to do so much better at educating ourselves. So looking forward to doing that with you this afternoon. So thank you, Dom.
Thank you very much, Anna. Her passion always shines through. We're not going to spend much time talking about Bluecrest, but I think it's helpful just to have a little bit of context around who we are. So Bluecrest was founded back in 2012, and the aim of our two founders at the time was to bring affordable and accessible health assessments into the market. And back then, there were really only 2 or 3 core providers who were offering health assessments at around the £900, £1,000 a mark. Price mark. So what our founders did was saw an opportunity to bring affordable and accessible health assessments to the market. And they did that predominantly focusing on a B2C market, so direct to consumer. Today, however, some years on, I joined the team in 2023. So in a post-COVID world, we know there's been a huge emergence of new entrants into this space, which is great because it gives people choice. And we've spent our time kind of thinking about who we want to serve. And over those years, we've been working with a number of different corporates. And over that time, we've worked in partnership with just shy of, I think it's about 1,502, if I'm even going to be precise, companies that have entered into regular health monitoring with us. So today we are the Health Intelligence Company, and our aim is to give people confidence in their health. And our mission is very simple. It's to help people live healthier for longer. And we know that by giving people insights into their health and from the action that they take, we see tangible differences in core health markers, quite considerable ones as well. So really, really vital work. And our vision is to hopefully enable around 1 million people every day to see their health insights on an interactive basis. So really, really exciting work. We love what we do. We're really passionate about it. We've done about 1.3 million health assessments since our inception. We run clinics across the whole of the UK and Ireland every day, typically within 20 minutes of most people's home addresses. We stand those up in hotel and conference venues, which is how we are able to keep our price point as affordable as it is. And we are laser focused on customer service. And it's really important to us that our customers are happy with the service that we provide. So we monitor that kind of NPS score, which is at over 60, and our customer service ratings are typically 4.5 and above, which we're incredibly proud of. So that's about as much as I will say about Bluecrest. And I think today the thing that we just need to lean into that's really important. So what we have been doing is looking at what does our data tell us about the individuals that come to health assessments at Bluecrest. And we have now analysed our data and just had this hot off the press, had it verified. This data is looking predominantly at our corporate workforce. And put simply, men and women are different. What the data tells us is what men face as general health issues are different to what we face as women with health issues. And the reason that I put this slide up was because I thought it was really interesting when you look at the bottom half of this graph, the number of women that go through or experience higher levels of anxiety and depression. And I have a firm belief, and we're just going through that final kind of data point around age ranges, but I have a firm belief that some of this will be driven at a time when women are entering perimenopause or going through menopause, which I can talk to from my own experience. But I just thought this was a really helpful insight into what do we see when people have regular health assessments with us. So a fundamental difference in those things. Very happy to take questions on that slide later on. So today we're going to cover off what menopause is, what the different stages of menopause are, the common symptoms. I'm going to tell you my story, and I'm going to be really candid about what I went through and the different symptoms that I've experienced, some of which are really deeply personal and are just not talked about, but I am going to share those. And then we'll talk about understanding your menopause journey through data and how you can use data to help you. I'll be delighted to hand over to Anna, who will take you through the next few slides.
Thank you, Dom. So let's get started. Let's start with some of the basics. So a topic that is so important, it affects 50% of the population, and yet we know it's still so misunderstood and just not spoken about enough. Encouragingly, we're really seeing a shift change out there, but we've still got a place to work so hard to make sure that we get that knowledge for ourselves, but also to help those around us, whether that's your friends, family, or colleagues. So menopause, what do we mean by it? Well, it's a natural biological process, and what it does is it marks the end of a woman's reproductive years. And of course, we commonly associate it, and we're quick to talk about the hot flushes, the mood changes, the brain fog that so many of us experience. But actually, it's far more than that. That is just a drop in the ocean when we talk about those. Because actually, menopause is complex. It's a complex physiological, emotional, and hormonal time of change that actually impacts a person's health and quality of life in many ways. It's significant. And it's really important that we get that understanding, not just for those that are experiencing it, but for our partners, families, employers. So as a society as a whole, we can manage it, we can open up those conversations and make sure people get the help and support they need. So let's take a look on the next slide, please, Dom, at the stages of menopause. So we break it into these 4 stages. So premenopause is when we're having those regular menstrual cycles. And that means our hormone levels are stable and we still have our fertility is present. Then typically, and it can be earlier, but in our 40s, women normally enter the period that we call perimenopause. And what that is a time when hormone levels, especially estrogen and progesterone, start to fluctuate. So that starts showing as symptoms of irregular periods, hot flashes, some of those mood swings, definitely sleep disturbances. And I think for women, it's certainly a time of unpredictability. Symptoms vary so much between individuals. It's hugely personal, menopause. But I think why this area is so significant, and it is changing through the increase in education, and that we talk about this now, we're far more open in sharing our experiences. But this happens at a time when many of us have been unprepared for this and then haven't given it that attention. And some of these symptoms to navigate are hugely worrying. And when we're not associating them against menopause, actually we can go down some different tangents and it can be a really worrying time about our health. And I think going back to Dom's slide where she was showing that data between men and women, and we see this high level of anxiety and depression, mental health in women, actually what the research is showing is so much of this may well have been misdiagnosed, and actually some of the root comes back to symptoms not being managed well enough in the perimenopause stage. So then we move into what we call menopause, and the definition of that is that we've had no period for 12 consecutive months. Usually occurs between ages 45 and 55, and by then the ovaries have significantly reduced their hormone production. So the estrogen and progesterone in particular drops sharply, and this will lead to more of those notable symptoms such as your night sweats and your hot flashes, potential anxiety, low mood is highly reported. So it's a major hormonal milestone. Then after menopause, we call it postmenopause, and this is the full year since a woman's last period. And what we see in this time is that those symptoms hopefully become less intense for most women, not all. And that's because the hormone levels have stabilized, albeit at a low level. But what is hugely significant about this stage is that we will then find ourselves with increased risk factors that negatively impact our health now and in the future. And these are where we need to take action to optimize our health and address for our longevity. So in particular, for example, the long-term effects of that estrogen disappearing, we will see playing out in symptoms such as osteoporosis, cardiovascular disease increases. And as we go through some of those slides, I will just show you some of those sharp changes we see in our overall health and what indeed we could do about it. So if we just have a little look at these 3 hormones here, these are the main 3 we talk about. So the one that everyone most talks about is estrogen. So this declines significantly during menopause, and I'm sure you all know will lead to some of those hot flashes, the night sweats. But that can be so debilitating, affecting our sleep. If we don't sleep well, it really doesn't set us up to manage the rest of our health and manage our daily work. We also, estrogen is hugely connected to vaginal dryness. Again, something people aren't always happy to talk about, but again, we're changing that narrative. And it's a common issue. We need to talk about it because it negatively impacts in terms of discomfort, in terms of pain, during sex. And the other thing we see because of this is increased risk in some women of infections, in particular urinary tract infections, that can be so problematic for some women. And then I will talk in a lot more detail in a minute, but we see estrogen and its vital role it plays in bone thinning. So we call that osteoporosis. And once we're at risk of osteoporosis, we're at high risk of fractures. And in fact, the mortality related to women's fractures post-menopausal age actually outweighs mortality for some of those big conditions we think about. In particular, we see those fractures in women's hips, spines, and wrists, and we can see a spiral, a downward spiral in a woman's overall health when this happens. Then I'm sure all of you know about the mood swings that many of us report, those memory issues, the brain fog, where some of us absolutely question, are we going mad? It can be a really disconcerting time if we really don't understand about this. So the other hormone we see a big drop, and it's a sharp drop, is progesterone, and it's progesterone's role to regulate the menstrual cycle and supports pregnancy. So as this starts to decline, that's what will bring about your irregular periods, especially during perimenopause, where we've got such hormone fluctuations. Progesterone is a real culprit about sleep disturbance, and that's just falling asleep, but also staying asleep, and that's sleep quality. And that's because progesterone has a really calming effect on the brain, and we miss it when it's not there. And then also we know progesterone also really does impact those mood changes. So that increased irritability, the anxiety, and we know that interplay with that brain chemistry, how that can play out and negatively impact our personal life, whether that's with us withdrawing from maybe some of our friendships or problems and tensions within our relationships, because we have those mood changes and swings that we don't always understand ourselves. And then let's come on to testosterone. So many people think this is the male hormone, which it is. They have much higher levels, but for us, it's still vitally important. And we have it in small amounts in our ovaries and our adrenal gland. And testosterone is really important because that's what drives our sex drive, so our libido, alongside some vital functions, just like estrogen, in terms of bone strength and muscle mass. And these are areas, as all of these hormones decline, we need to take much more steps in our behaviours, lifestyle habits, which Dom will talk about later, to strengthen, for example, our muscle mass and our bone density. So really significant. I will talk about some of the replacement therapy you can do across those three hormones. If we can have next slide, please, Dom. So common symptoms, as I'm sure we're getting more and more familiar. We've talked about irregular periods, those hot flashes, those night sweats, trouble sleeping, pain during sex, loss of libido, infections, brain fog, joint aches. There's a lot going on. We haven't even touched on those things such as dry skin, thinning hair, weight gain around our abdomen, which is really significant in terms of our cardiovascular risk. But there's less known things, tingling in hands and feet, a real change in our oral sensitivity, dry mouth, something I really have, to the point I've been investigated for diabetes, but actually I've done my research and really can see it's related to these fluctuating hormones. And I think a webinar in itself, what we're learning about menopause and the gut, the change in microbiome, but for most of us as well, we're well aware of the difference in terms of gas retention, the bloating, maybe developing those like IBS symptoms. So much going on that we are managing and we need to understand. So if we can just go on to the next slide, please. And this is where it gets a concern, and this is the bit where to listen hard, because we've talked about how these symptoms may well affect us in the here and now. But my plea to you is to understand the effect on our long-term health risk, so that you can start to make those changes now and get into that preventative health space. because what we see when we lose the protective factor of estrogen, we see our risk of cardiovascular disease massively increasing. So up to menopause age, men are more at risk than women of cardiovascular disease, but that equals out as we go into menopause because we lose that estrogen. One of the driving things about that is the extra weight gain that women have. Particularly, we gain weight in the most risky place, which is our abdomen. So the visceral fat, hugely related to putting up our risk for a cardiovascular event. So your strokes, your peripheral arterial disease, your cholesterol. Also, our type 2 diabetes risk increases post-menopause. And again, that is due to the weight gain that many of us have, but also it's connected to our decreased insulin sensitivity. And again, when we put diabetes, cardiovascular risk together, we're then putting our metabolic health at significant risk. So the other one, and there's so many I could point out, but please have a think about bone density. If you go to any conference around menopause, you will really hear this discussed in detail. We lose the strength of our bones. So the net loss of bone density is about 20% in the first 5 years of menopause. So our bone health is significantly affected. What we will see is it's the estrogen that helps to regulate that natural cycle of bone breakdown and rebuilding. So we have bone breakdown, which is called resorption, and then bone rebuilding, which is formation. And where we see a decline in this, we're at risk of osteopenia, which is that early bone loss stage, and then can go on to osteoporosis, which is that bone thinning that then increases the risk of fractures. And this is what we really worry about. And I mentioned it earlier, but women with hip fractures in older women are linked 3 times more to entering long-term care compared to somebody that hasn't had that fracture. And we can do something about it, but it needs to start as early as you can. I'm mindful I haven't started this early enough, so have to work hard now. But it's about that weight bearing and resistance exercise, optimizing your calcium, your vitamin D, and pursue DEXA scans to look at your bone density, really important. And then it's very much personal choice of what treatment you get, but HRT plays a fundamental role in helping protect our bone density. So something definitely for you to consider and go and discuss with your own health professional or one of Bluecrest's professionals if you're having the menopause profile with us. And then, like I said, huge, significant issues around mental health. Again, is getting that right diagnosis, getting that right support in. Can you optimize some of that mental clarity through optimizing your vitamins, your mineral intake? So again, this is just some of the long-term risks for women that may well be experiencing. And again, it's a webinar in itself around urinary issues, urinary infection, losing some of that level of continence, the frequency, urgency. It's all about getting that support early, because there really is people that can help you to optimize your health. So hopefully that's a bit of a whistle-stop tour. There's so much always to cover, but I think I'm going to pass on to Dom, who's going to share her very personal experience with you.
Thank you, Anna, and I'll try to do this quite quickly because I know there were some hands going up through Anna's slides. But I didn't really know much about menopause at all, so my journey started before I joined Bluecrest, and today the insight I have into prevention is 1,000% better than it was when I first took over running this team. And it was during COVID. I was running a home care business, so I was full on providing care to people in their own homes through the COVID pandemic. And I worked through that period running around the country trying to make sure our clients were kept safe. And I'd be at home doing my emails when I started to notice that I'd go to write an email and couldn't find one of the most basic words. So I'd go to write an email, and I pride myself, by the way, on how well I write. I'm not perfect, but I'm pretty good at grammar and spelling and using appropriate language. And I couldn't find simple words, and I'd have to dance around the word to find an alternative in order to write my email. I didn't tell a soul for 6 months. And the reason I didn't tell anybody was because I thought I had dementia. And why did I think that? I've been working in social care for well over 15 years, and I'd done loads of work working with people with young onset dementia. And one of the symptoms and signs of young onset dementia is difficulty finding words. And I was really frightened because I've seen what the impact of dementia can have on people, either family members or in particular those that I was serving. And about 6 months in, I didn't tell my husband, didn't tell anybody. One night I went to bed and I had this overwhelming heat that started at my toes and went through my body and up through my body. And over the course of a week, I can only describe what became an onslaught of hot flashes in a way that was beyond ridiculous. I logged them in one day and I had 36 in a 24-hour period. And at that point, I'd not long started working with a fitness coach. I think lots of people through COVID did what we all did and probably ate and drank a little bit too much. I put on some weight. I wanted to do something about that. And it was through talking to her that she said to me, you could be perimenopausal. And I'm ashamed to say I didn't really know what that was back then. And she said to me, Dom, I would really recommend that you go and make a GP appointment, see somebody and talk about it. I couldn't get a GP appointment for love nor money. Now, that was probably linked to the time we were in. And by the way, I was 46 back then. Today, I'm 52. And the long and short of it was I then went and paid to see a private consultant, and I paid quite a lot of money. And I don't think any of us should have to do that, by the way. It was about £700. I went to see somebody who went through a menopause questionnaire with me, who reassured me around things like the risk of HRT. And then I went on to start taking HRT, and I took it because I couldn't function. The hot flashes were just impacting everything. They impacted my day, my work, conversations at home. They were impacting my ability to stand up in front of my team, have a conversation. It was debilitating. It was really, really, really difficult. I couldn't sleep. I was tired. I was going to the toilet all of the time. I was grouchy. I was really difficult to be. I think my husband would quite happy to tell you that I was and can still be quite difficult to be with at sometimes, because I'm still on my menopause journey, notwithstanding I'm coming through those stages that Anna took us through earlier on. And I went on to start taking HRT. That almost eradicated my hot flashes overnight, and it definitely stabilized my symptoms. But I did that knowing what the risks were. I was pretty fit. The coach I was working with was an expert in women's health and an expert in over 40s, which really helped because I had been a bit of a cardio bunny before. So a lot of my exercise would have been running and that kind of thing. And actually, I pivoted entirely to strength exercise and started working on my muscle strengths. I looked at my diet. And it wasn't a diet in terms of restricting what I ate, but it was making sure that my diet had much more within it in terms of more wide and varied things. So seeds, drinking lots of water, making sure that I had rehydration salts, making sure that that I was having a gap, not snacking too much. I wasn't limiting my food intake. If anything, I actually increased it. More vegetables, more fruit. Good levels of protein, which are really, really important when you try and stabilize things. And then I got on top of it. And, if you roll on a couple of years, I joined the team here at Bluecrest. And very quickly, my team that look after our corporate customers lobbied me because they were like, we do nothing for our corporates around this really important subject, yet so many of the women we care for and look after need help with guidance and support around menopause. So I made it my mission to bring a menopause product to the market that was affordable and accessible. We'll go on to talk about that very briefly at the end here. But it didn't stop there, right? So it wasn't that long ago, probably a year ago, where I turned up at a dinner with some friends and was discreetly pulling cystitis tablets out of my bag because I had terrible pain down below. And one of my friends, who's quite bold, grabbed the packet off of me and said to me, what's this for? And I said, I just think I've got cystitis. It's really uncomfortable. I've been like it for a couple of weeks. It won't go away. That, of course, went on to be the symptoms that comes with having dry vagina. It starts to impact on things like libido. You don't want anyone to touch you. That has an impact on things like relationships. I I'm making it sound delightful, aren't I? But through this period, I think one of the things that I would say to any of you is, number one, talk to somebody. Don't be frightened to tell somebody if you've got symptoms. It's much more talked about today than it was when I was 46. So I think that's a really good thing. As a female leader, I lean into that. So all of my team, whether they're of my age or younger or older, hear me talk incredibly openly about menopause. And there are times when I'll sit in a meeting and I'll go to say something and I can't remember what it was. That can be quite embarrassing. But I lean into it and I tell people this is one of my menopause symptoms. I used to be brilliant with names. I'm rubbish with names now, which is one of the things I used to pride myself on. You learn to adapt. HRT might not be for everybody. It was right for me. I went through the journey, by the way, of whether I would take testosterone or not, and I did for a while because libido was a problem for me. But I learned quite quickly that actually the level of estrogen through my hormone profile tracking was more important, and actually getting that in the right place helped with some of those other symptoms. So that is a real whistle stop tour, but it affects everything. It affects how you feel, how you think, how you sleep, how you lead, how you show up. It affects home, it affects work, it affects relationships with family and with friends. And if you have the right support network around you where you can talk quite openly and candidly, and actually with a lot of my friends now, we laugh a lot about this, it just helps you move through it, and it can make a really big difference. So hopefully my honesty has given you a little bit of insight, a really brief insight into my quite long journey of menopause. And it is a long time and it doesn't stay the same. But please, if any of you want to talk to me, I'd be really open to doing so. Don't be frightened to talk about this. Good leaders will wrap love around you. Good businesses will wrap love around you. And I see that as our female responsibility in doing this. And I don't know if there are any men on this menopause, but on this menopause webinar. But I've spent a lot of time trying to educate my husband, who tries really hard to be patient, isn't always. But give them a little bit of slack, because it isn't always easy to understand what goes on in our heads and our bodies. And I know it's not always easy for everybody to understand, but that's kind of my menopause journey. I know we're overrunning, so stay if you can. If we could go on to the next slide, that would be great. There are a number of options, right? I've talked about HRT. Making sure you look at that in the context of your hormone profile, I think, is really important. I was taking testosterone when actually my estrogen levels were quite low, and testosterone just gets converted to estrogen if that's not right. So understanding that is really, really, really important. Diet is really important. Lifestyle changes are really important. It's not doing everything perfectly well, right? It's taking a step towards a bit of exercise, getting out in the fresh air, making sure that you eat slightly better than maybe you did. Drink less. Alcohol doesn't help. That's not to say don't drink at all, but it doesn't help. It certainly doesn't help with things like hot flashes. So there are lots of things that you can do. Staying on top of it is important because health tracking is really, really important. And I have osteoporosis in my family. So HRT was important to me because I didn't want to go through the risk of things like hip fracture. So really, really important. And then regular health monitoring, it can be an enabler and a helpful thing. And this is not a sales pitch, I promise, but getting insights, whether it's through us or anybody else, into the wider biomarkers, your BMI, your biometrics, your metabolic health, your cardiovascular markers, your triglycerides, all, your thyroid, all those kinds of things in the round play a really important part in how you interpret some of that hormone information as well. So it's difficult to do it in a linear way. So I'd really recommend you do any hormone testing in the context of a wider health assessment. I think it's super, super important. So that I'm really happy to take questions, and I'm happy to stay on. So if anybody would like to ask a question, please feel free. Have we got some in the chat?
We've got lots going on in the chat. I'm just trying to get through as many as we can. I think I read.
Yes, we'll share the slides. We're very happy to share the slides.
Yeah. I think someone was brave to share their story about surgical menopause, which I agree we haven't touched on, and it rarely is. So thank you for sharing your experience. I think that's again a webinar in itself, and something we could look to try to facilitate. My hope is that as menopause is talked about and gets traction, we will then start diving in and understanding some of these topics more, because we hear time and time again you're left to navigate this on your own. So for those of you that didn't realise, that surgical menopause is where you've normally had an operation young that puts you into very early menopause, and of course it comes without warning. There's no gradual fluctuation. All of a sudden those hormones disappear and can leave you with significant symptoms. So thank you for sharing that.
Somebody's asked about the Mirena coil. That is a treat that is used to treat menopause. So some of my friends have Mirena as their progesterone tool, so that's not unusual and it can be used. Yeah. HRT comes in a number of forms. So for me, I take tablets for progesterone and I use a pump for my estrogen. The great thing about that is that you can vary dose quite easily. Some people have the patch. It really depends on what your wider contexts and symptoms are as to what will be best for you. A very good friend of mine has had 2 hip replacements. She wasn't given HRT before her menopause. She's now been given it as a treatment mechanism for potential osteoporosis. So there are, she's furious that nobody took her symptoms seriously when she probably needed that hormone replacement. So it really is incredibly personal, and it does vary. My journey has been 6 years so far. I don't think I'm quite out the other side of it yet, and I haven't been 12 months period free, but I'm getting very close to that. So I'm probably coming out the other side, and I will start to think about, can I taper some of that medication and see what happens when I do. I think it's different for everybody. Is there anything else in there, Anna, that we haven't picked up?
Just see if you I like the comment about emotions colliding at the same time as teenagers. I think that's a disaster, isn't it, waiting to happen. But about educating, I think having those open conversations like Dom's done with her family, have them with your children, that this is what it's like for me, for
Definitely.
sure.
There's a really important one around companies, actually, Anna, in here. So have a look at what your company, right, first and foremost, this April, it becomes mandated that there needs to be a clear plan for managing menopause in your workplace. So your HR teams and your chief exec, your senior team should be thinking about, how does our workplace support people going through this? So that should be happening. Go and ask your HR teams, go and ask your leaders. Your leaders should know what they're doing. So menopause action plans are a requirement. But I think the thing that is super helpful is, if you have, within whatever health benefits you have, if you have the ability to do health assessments where you get, for want of a better description, a full body MOT that gives you an insight into your all-round health, that is a really good place from which to then add on the advanced menopause profile, which you can do. And by the way, I paid 700 quid back in whenever it was to see a consultant. Our menopause package is 169. You get your hormone profile and you get a women's health consult that will be done in the context of your wider symptoms. So we're trying to make this thing so much more affordable than it's historically been. But by all means, come and talk to us if any of you want to talk about what we can offer for business. We'd be very happy to do that. Things like the weightlifting somebody's commented on. It's not about how much weight you can lift. It's about doing regular strength exercise such that you look after your muscles and your bone health, which is really important. Now, I'm really conscious we've run over by 6 minutes, so we probably need to end it there. But there is a hand up, so I don't know whose hand that is and whether we can allow this individual to say something, but I'd love to hear if our system lets us do that. If not, pop your question in there. Magnesium helps. I take magnesium. Should have said that.
Yeah. I can answer that one. I'm trying to type quick enough to get back to you all. But is there supplements women can take before going on HRT? Yes, there's loads of products out there. You only need to go in and do a Google search. It will bring up so many. So you can either get a kind of perimenopause product, or my advice would be really look at optimizing your magnesium, your calcium and your omega, because they are really going to set you up for that underlying health. So have a look at those. And
Yeah, good fats, avocados, that's one of my go-tos.
yeah,
Some really good healthy fats, really important. Olive oil, really important.
yeah. And I like the one that's me as well. Didn't recognise it was perimenopause, but thought let's try HRT. I did that because I thought it's either something or I'm depressed or anxious, which wasn't me. And actually, I hadn't recognised other signs, and it's been a game changer. So just have that conversation. A trial might just be the game changer for you. So thank you for
What
sharing
we'll
that.
do, there's some really lovely observations in this chat. So
Yeah,
we'll share this with you. We'll take some of the notes out of the chat because some of you are giving really good advice around I don't eat too much sugar because that doesn't help either, you know. So we'll pull that together in a these are some of the hints and tips our attendees also gave, because what's right for one person isn't right for somebody else. But like I said, if any of you want to talk to me or Anna, we're really open to it. So feel free to drop us an email. We'd love to hear from you. Thank you so much for giving us your time today. It's really, really very much appreciated. And I hope this was somewhat helpful. So thank you very much.
thank you. And I'll work through those questions for you.
Well, Molly, you've got your hand up. Happy to, if we can get you talking to us, that would be great. I know this is configured a certain way, so if we can't, then we can happily talk to you offline, so we can reach out to you, no problem at all. I think that's what we'll do. We'll end it there. Thank you, everybody. Have a great rest of your day.
Take care. Bye.